Okay, welcome back again. So, merry afternoon. This is the continuation of our discussion. So, I'll be discussing the manifestation of pregnancy and the labor, stages of labor. So, this is what you research. Okay, so check if your research is correct. So, this is the correct information that I want you to have research. Okay, so first, so you can see again, there is a blue font here where you can check and watch for um, videos. Okay, so you can watch this later after this video. Okay, so we have three kinds of signs and symptoms or manifestations of pregnancy. One is presumptive, the other is possible or probable. Number three is positive. So, presumptive meaning it is more of a symptom rather than a sign. So, what is the difference between a symptom and a sign? When we say a symptom, this is what the patient felt. This is more of feelings. Okay, this is more of um, subjective cues. So, meaning this is being expressed by the client or the mother. When we say a sign, this is measurable, something being measured, okay? Measured by a doctor, OB-GYN, midwife, or a nurse, okay? So that's the difference between symptom and a sign, okay? So for presumptive sign of pregnancy, it is more of a symptom. This is more of what the parent or the mother felt. The possible or the probable sign, this is more of um, the the test given by the doctor, the midwife, or the nurse. Okay, it is more of a sign rather than a symptom. Okay, so again, possible is more of sign rather than a symptom. Okay, so for the positive sign, this is the confirmation that you are or the mother is pregnant. Okay, so this is also a test, okay, which confirms that there is a growing baby inside the uterus. Okay, so let's start with the presumptive signs. The first presumptive sign is amenorrhea. When we say amenorrhea, um, this is the cessation. Okay, cessation of your menstruation. Okay, a means nothing, menorrhea meaning menstruation. Okay, 10-day allowance if you have irregular menstruation. 10 days after expected period, positive pregnancy due to increased HCG. Okay, but sometimes it is not absolute, especially for those who are irregular, those who have irregular menstruation. Okay, so again, amenorrhea is the cessation of your menstruation. Okay, next, breast changes. When we say tenderness, this is when you press the part, then you felt pain. Okay, so that is tenderness. Pressing the part, then when you are pressing that part, you are feeling pain or are comfortable to feel. Okay, so tenderness and tingling sensation. Okay, and this is not absolute again. Okay, this could mean other other diseases or other symptoms. Okay, next, change in urination. So there is a frequency in urination, okay, present in first and third trimester because um, the womb is getting bigger, so it presses to your urinary bladder. So there is a feeling of frequency in urination. For second trimester, it disappears, um, but you can feel it, okay? So the third, it becomes more bigger, okay? That's why it presses against the urinary bladder. So there will be change in urination, okay? Next, nausea and vomiting. Nausea, vomiting, because of the increase of level of HCG or human chorionic gonadotropin, there is a changes in hormones. Okay, that's why you have nausea and vomiting, or what we call morning sickness. Okay, so HCG increases 2 to 3 months of pregnancy. Okay, so what do we need to do as caregivers? You should always provide unsalted crackers. Next ay chips, small frequent feedings. Okay? Small frequent meals para hindi madaling masuka si mother. Okay? Split food into two halves. Give meals every after 2 hours. Less fatty foods in diet, and do not lie supine after eating. It should be the back or the head is higher than the rest of the body. Okay? Supine meaning lying on your back. And always encourage ambulation, because when we are encouraging ambulation, um, we are encouraging peristalsis movement. So peristalsis movement, so this is the normal movement of your um, gastrointestinal tract. Okay? So if nausea and vomiting is severe, consider hydration, vomiting, hypokalemia, and electrolyte imbalance. So meaning if there is a severe, what do you call this? Nausea and vomiting, you should check for dehydration of the patient and electrolyte imbalance. You can give Orisol or electrolytes or Gatorade. Okay? So next would be fatigue. Okay? Fatigue because um, there is a growing fetus in the uterus. So the womb and the body uses lots of energy. Okay? Skin changes brought about by hormonal changes. Okay? Because of estrogen. Cloasma, okay, mask of pregnancy, visible in cheeks. Okay? This is what cloasma look like. Okay? Like this one. Yeah. So that is cloasma. Okay? There is brownish discoloration in the face. It's because of our estrogen. Okay? Cloasma. Then melasma, darkening of the neck. Choco na batok. Okay? Melasma. Sorry. Melasma in pregnant. Okay. So there are no pictures of melasma, but there are changes of colors in the neck. So that is what you call melasma. Okay? So cloasma again is the mask of pregnancy. Okay, melasma is darkening of the neck. Linea negra, okay, linea negra is the line in the abdomen of the mother. Okay, this one. Yeah, that is what you call linea negra. Okay? So the line, it's because of the hormones, estrogen. And Striae gravidarum, ito yung tinatawag natin sa Tagalog na kamot. Okay? So Striae gravidarum, it's because of the extension of the skins, or because the skins are being expanded. So, yan yung tinatawag nating kamot. Striae gravidarum. Okay? So, that's it. So, that is your presumptive signs. Again, presumptives are more of a symptom. Now, let's go to probable signs, more of the signs. Okay? So, abdominal enlargement, of course, there is abdominal enlargement. Okay? Makikita naman natin yan sa buntis. Okay? Abdominal enlargement. So, symmetrical and globular sa pabilog. Okay? Less than 18 weeks, lalabas na siya. If the uterus at the level of the symphysis pubis, age of gestation is 12 weeks. Although this is mostly done by the nurses and the midwife. Okay? But one probable sign is the abdominal enlargement. Okay? So next, ballotment. Okay, ballotment is when you tap the uterus, there is a sensation that something is sinking and floating. Okay? Commonly, these are being measured by your midwives, by your doctors, your OB-GYNs, and the nurses. Okay? This is not your responsibility. Okay? But I'm teaching this so that you know. Okay? When we say Braxton Hicks is false labor. It seems that your womb is contracting. Although it is contracting already, but it's a false labor. So that's what we call Braxton Hicks. Remember that. Okay? When we say Chadwick sign, this is the bluish purple discoloration of the vagina because of vascularity. Okay? That's the color of your cervix. So that is the Chadwick sign. When we say the Goodell sign, this is the softening of the cervix. Like this one, the cervix softening. So because of, and it is dilating. Okay? So we have for the cervix, Chadwick sign, bluish discoloration. Goodell sign, we have softening of the cervix. And we have Heger sign, which is softening of the lower segment. Okay? Although this is not mostly felt, okay, because Goodell's is mostly of the cervix, this one, the Heger sign is the neck here, the area here, the softening of that area. Okay? Then, positive in pregnancy test, okay, there is an increase in HCG level, okay, although there are diseases that also increase your HCG level, causing you to have a positive pregnancy. Okay, that's why this is only a probable sign. Okay, so 10 days after missed period, this can be detected already. The peak level of HCG is 10 weeks age of gestation or 2.5 months. Okay, so if the pregnant mother does have a amenorrhea for 10 days or missed menstruation, the mother can get the mother can use the pregnancy test already. Okay? So let's go with the positive manifestation. When we say positive manifestation, this is the confirmation that there is already a growing baby inside or growing fetus inside the mother's womb. One is there is a fetal heart tone. So meaning you can already hear the heart tone of the fetus using ultrasound, Doppler. This is a portable microphone-like instrument. Fetoscope or stethoscope, you can also hear that. Then external electronic fetal monitor. Okay? So, positive sign, again, there is a fetal heart tone. Next, there is quickening. When we say quickening, this is the movement of the baby. Okay? It feels like there is something moving inside the abdomen. Okay? That's what we call quickening. Felt by examiner is a positive sign of pregnancy. Quickening felt by mother is a presumptive sign. So this should be felt by the examiner, the quickening or movement. Okay? In primigravida or first-time mothers, this occurs later than 20 weeks. Okay? After 20 weeks. So in multigravida, in previous mothers or mothers with already children, 16 weeks. Okay? So after that, we also have X-ray. So when there is a fetal skeleton already in our X-ray. Okay? So we can say the mother is pregnant. Okay? Then, pulsation of heart of baby through ultrasound. So if there is a heartbeat na during the ultrasound. So, those are the positive signs. So, again, we have three presumptive signs, possible or probable signs, and positive signs. Okay. Let's go now to labor. So, the first stage of labor is uterine contraction. Okay? To full cervical dilation of 10 centimeters. So, this starts if there is already a uterine contraction. Okay? There are three phases of stage 1. We have the latent phase, the active phase, and the transitional phase. So remember, LAT. LAT. Latent phase, active phase, and transitional phase. In the latent phase of first stage of labor, there is cervical dilation unto 3 centimeters. Okay? So uterine contraction, the duration is last for 20 to 40 seconds with interval of 5 to 10 minutes and mild intensity. Okay? For second phase, active phase, cervical dilation of 4 centimeters to 7 centimeters with duration of 30 seconds to 50 seconds. So meaning the contraction lasts for 30 to 50 seconds with a shorter interval of 2 to 5 minutes. Okay? So ibig sabihin, second phase, sumahaba yung contraction, tapos lumiliit yung pagkasunod-sunod, then moderate intensity. For the third phase of our contraction, the transitional phase, 8 to 10 centimeters, ibig sabihin, palabas na si baby. Okay? So, duration, the contraction lasts for 60 seconds or 1 minute, then 2 to 3 minutes ang interval, and very painful and strong intensity ang contraction. Okay? What do you need to remember? Always establish rapport with client. You should gain trust and also decrease the pain and providing comfort kapag merong trust ang pasyente sa inyo. Okay? It also decreases anxiety. Okay. You should establish baseline information. Alam niyo naman kung paano G1, G and P, gravity and parity. Then age, again, age, more than 35 and less than 18 years old are high risk. Okay, contraction, when did it start? Time of duration, how frequent is the contraction? You should remember this one. Duration, interval, and intensity. Okay? Color of amniotic fluid, it should be water-like. Okay? Clear with some white specks and cheesy vernix. I show you the vernix caseosa already. Okay? You should know how to look for it. If greenish, it's a meconium stain. So si baby nagpupo na sa loob ng tiyan. So hypoxia is effect. Okay? Magkakaroon na ng decreased oxygen dun sa baby. Okay? So, the baby will be distressed kapag nag-meconium stain na tayo, kulay green, yung kanyang amniotic fluid, kailangan na nating cesarean. Okay? We also need to remember previous medical history. Okay? Kasi baka may complication. Like for example, um, may diabetes ba siya? Meron ba siyang heart problem? Okay? Kailangan natin yung malaman. Time of last meal and drink. We should also know that because for example, for general anesthesia, lalo na pag cesarean, okay, and local anesthesia. Medication, if the patient is alcoholic or not, kasi pag masyadong alcoholic si patient, mataas ang tolerance niya with sedation, with anesthesia, so hindi gagana. Okay? So, 5, establish maternal vital signs. So, for first stage or latent phase, kailangan nating isipin 4 hours ang kanyang vital signs and every hour ang kanyang BP. Kapag active phase na, every hour na ang vital signs and every 30 minutes na ang BP. Okay? And for last stage, transitional up to birth, okay, every hour ang kanyang BP, ang kanyang vital signs and BP should be taken every 15 minutes. Okay? So do not take blood pressure if there is a contraction kasi if there are contraction due to pain, pain increases blood pressure. So if it increases blood pressure, you're going to get a false high result when you are taking blood pressure. Okay? Next is you should check for fetal heart tone, although this is done by your nurses, midwife, and doctors. But in case you need that, you need to measure fetal heart tone. Okay? Next, assess for cervical dilation. And again, this is done by your midwife, nurses, and doctor. Okay? So, second stage of labor, full cervical dilation up to delivery of fetus. Okay, that's the second stage. Okay. The stage of labor, commonly for prima gravida or first-time mothers, 1 to 4 hours lang yan. Okay? Pero kapag medyo marami ng anak, mabilis lang yan. Okay? Konting ubo lang, lalabas na yan. Okay? Next, third stage of labor, delivery of baby to delivery of placenta. Okay? This lasts for 5 to 10 minutes. Maximum waiting time is 30 minutes. Beyond 30 minutes, it is abnormal already. Signs of placenta expulsion, lengthening of a cord, sudden gush, uterus becomes firm and globular, okay? Rising of the uterus of the abdomen. Commonly, this is done by your, nurses, midwife, and doctors. Pero you should check that nalabas na dapat yung placenta after ng baby. Okay? So, fourth stage of labor, first 1 to 2 hours after delivery of placenta, okay, you need to check for crucial problem or main problem at this stage. Okay? Should be checking bleeding. Okay? Kasi there is a rupture of membranes, yung placenta, so dapat hindi continuous ang bleeding natin dito. Then, episiotomy kasi, when we say episiotomy, and episiotomy is where we are cutting yung part, this one. Yan. We are cutting the perineum of the mother. Okay? To give way for the expulsion of baby. This is the episiotomy. This one. Okay? So it's because of over stress. Okay? So we need to check for the bleeding. Okay? And bleeding, for bleeding, this is where lochia will come. Okay, so we have lochia rubra. Okay, lochia rubra. So that is for Diego's name, lochia rubra. Okay. So alam nyo naman yung mga signs ng lochia. Okay? So if lochia rubra extends for 5 days, it's irregular already. Okay? All the retained water retained previously will be absorbed into the circulation. So there will be an increase in cardiac output. So there is an increase in cardiac output. There will be an increase in blood pressure. And when there is an increase in blood pressure, there is an increase in oxygen consumption. Okay, so that will be for your manifestation of pregnancy and labor. As you can see, for this, we also have our YouTube site where you can see and review and watch for further knowledge. Okay, so again, please wait for the next activity and for the next discussion. Okay, thank you and goodbye.